welcome everybody. Particularly welcome many people in the audience today who've been involved in this fantastic journey that we've been on over the last 12 months in relation to the Next Stage review. It's been a remarkable journey for many of us, and hopefully today we'll see the culmination of the first part of that journey with the publication of the Next Stage review. Alan Johnson is going to speak to us briefly, then Lord Darcy is going to take us through the main points of his report. Without any further ado then, can I introduce Alan Johnson, Secretary of State for Health.
This is your report, actually. We've been just talking to the press about this being an enabling report, building on the work you've done in all your clinical teams, in the 8 clinical pathways, in the 72 working groups right across the country. And what I hope you'll see today is national action to ensure that your local ideas are actually put into place. So in a sense, you've let 1,000 flowers bloom. The NHS, from a system which is world-class in many aspects to world-class in all aspects. Your immense contribution is greatly appreciated. Thank you very much.
Thank you, Alan. Thank you all for coming here today. It's been a great privilege to be doing this piece of work with the 2,000 clinicians and staff across the country over the last 12 months. Your report, as I describe, is the enabling report to make all of these visions happen over the next decade. I think most of us in this room would agree what energizes staff, but more importantly, what's important to the patients that we serve, is ultimately the quality of care they receive at the most vulnerable time in their life. I know, and you know out there, the only way you're going to have the impact of quality is to lead that change at a local level. And that is exactly what you've done in your 10 different reports. Let's challenge ourselves. Could we be more proactive in relation getting the NHS ready to some of the challenges facing us in the future? We all acknowledge that well-being and prevention has an individual responsibility, has a family responsibility, has a community responsibility, but also the society responsible in maintaining this vision. The talent of the doctors, the nurses, the midwives, the social care workers, the voluntary sector, the professional bodies who've really engaged in this report. And we have to unlock this talent at a local level. All of us know healthcare delivery in the future will be team-based. That is why we are measuring at a team level. The Constitution sets out key principles of what the NHS is all about, rights for patients which are clearly articulated, pledges to staff and patients, and also the decision-making and the transparency of decision-making more clearly explained. This is your enabling report, which has really been framed with a constitution that protects not just the patient, but also the staff in making this vision happen. It starts from today. It is our chance to make this happen, and I'm very proud to be part of that, still working as a clinician in the health service. Thank you.
Mr. Speaker, with permission, I'd like to make a statement on the final report of the NHS Next Stage review and the first NHS Constitution. The NHS is now able to deliver the highest quality of care in many medical disciplines and settings. The report published today heralds the next stage for the NHS to deliver the highest quality of care for all. It is underpinned by the service's first constitution that will empower patients by clearly articulating their many rights, bringing transparency to decision-making and securing its founding principles for generations to come. The report puts the NHS on the front foot, seizing the opportunities that these challenges present rather than simply reacting to their consequences. As much as the NHS will do more to help people to stay healthy, it will also become a service that responds more rapidly and effectively to the people that use it. We must have an unwavering, unrelented, unprecedented focus on quality. Our approach will be dedicated and disciplined, putting quality at the heart of everything that the NHS does. We will harness the expertise and experience of clinicians to raise standards by ensuring strong clinical involvement at every level of the NHS. We will create an environment where excellence and innovation can flourish. That is why this report heralds new partnerships between the NHS, universities and industry to achieve the very best care for patients. We will ensure that NHS staff have the freedom to focus on quality, empowering them to improve services. We will pursue our ambition to deliver the highest quality of care to all, not in some respects, not in many respects, but in all respects. On its 60th anniversary, after a decade of investment, the NHS has the most talented array of staff in its history, united in their ambition. High quality care for all is now within our reach. The report charts a path towards its achievement, and I commend it to the House.
This review has really met Marie Curie's expectations. I think in the last 8 years, this has been the best example of the Department of Health and the NHS engaging with a core voluntary sector stakeholder, and we felt involved at every stage of the process.
I'm delighted. I wasn't cynical. I'm always aware that if you engage clinicians and staff, bottom up, top down, you'll get the best results.
Public events were really quite exciting, and I think it then built up a head of steam that drove it itself, and hopefully will continue to drive it itself.
We've involved doctors, nurses, midwives, all sorts of staff, and included social services and other organisations.
I've been involved in different reviews in the NHS in the past where I would have known exactly at the beginning what the outcome was going to be today. But with this one, we had our clinicians, our public involved, and so we really didn't know what to expect. So we're really happy to be committed now to the delivery stage.
All the GP involvement too was also positive because they saw it as a way of enhancing their practice. But as I say, our community health services staff are particularly pleased with the way we're doing things.
Lord Darcy has brought a certain personal passion and a commitment to patients, carers and quality that rings well with Marie Curie's own key tenets. So the answer to the question of whether or not it has been unique is that it has been.
I've worked in the health service a long time now, and I think this is the first time that so many clinicians from all aspects, and by clinicians I don't necessarily mean doctors, I mean nurses as well, have actually joined together. So I think that made it different to everything else that I've been involved in.
I am absolutely convinced that this is a key moment in the development of the NHS in its 60th year. We have a whole set of proposals here to help people take services and improvements for their patients forward. I am absolutely convinced that we can do it. Every bit of information that we've got about the enthusiasm and dynamism being shown by people on the front line shows that we can do it. So let's go out of this room today, work together, work with our patients, work with our public, work with the staff and really transform the NHS to make it a service that our people really deserve. Thank you.